All right, guys, welcome to our podcast. Let's talk about poop. Where in today's podcast, we're going to do a deep dive on everything you need to know about what happens to your body when your gallbladder is removed. I have a lot of patients who come to see me who have issues after their gallbladder is removed. So we're going to do a deep dive into this. We'll discuss exactly what does your gallbladder do. We'll discuss reasons why you may get your gallbladder removed. And we'll discuss the main complications that I have seen as a Mayo Clinic trained GI doctor. What happens whenever you get your gallbladder removed. We'll discuss the pain, the diarrhea, the reflux, maybe the bad bacteria that can propagate inside your gut. And we'll talk about some general tips that I recommend. I'll discuss foods I recommend. Also discuss foods that I recommend to avoid as well. And if you're watching the live stream, we'll discuss any questions you guys have on the live stream as well. So if you're joining for the first time, my name is Dr. Islam. I'm a board certified years treating patients with all sorts of GI issues, including those individuals or even post gallbladder issues as well. Smash that like button, like, share, and subscribe. Give us a 5-star rating. The social media giants and podcasters, they get their podcasts known through these ratings as well. And so if you have any questions, let me know on the live stream as well. So we'll discuss exactly what the gallbladder is, what it does, and how we use it. So let's go and begin. So what exactly does the gallbladder do? The gallbladder is an organ that sits right under the liver on the right side of your abdomen. It sits right under the liver. What happens is that your liver actually is an organ to store bile. And bile goes through what are called the biliary ducts from the liver and actually ends up going into part of your gallbladder. The gallbladder is the organ to actually store bile. And so it's actually a storage house for anything that's going on inside your body. Bile is used basically to help absorb fat. So whenever you have a fatty meal, your gallbladder actually contracts to secrete out that bile so you can absorb that fat, and you can absorb that fat into your body so you can hopefully use that for whatever nutritional needs that you have. And your gallbladder is basically an organ to store that bile. Now, as it stores bile, that bile has fat, cholesterol in them, and that can also form what are called gallstones in your gallbladder. So it's very common to have gallstones in your gallbladder. It's probably the normal consequence of having a gallbladder. But basically, your gallbladder is just an organ just to store bile to be secreted whenever you have fat in your body. Now, there are a couple of different reasons why you need to or should get your gallbladder removed. The first one, stones. So having gallstones, especially symptomatic gallstones, is a reason to get your gallbladder removed. So what are those symptoms? Typically, it's pain on that right side, especially what is called biliary colic. It's pain that occurs after eating. It has a specific way of being described whenever somebody has gallbladder pain. It's pain that occurs after eating, can sometimes radiate to your back as well, on that right side. So it's not pain in the lower abdomen. It's not pain on your left side. It's not generalized pain. And typically this pain occurs after you eat. This is the classic symptom of what's called biliary colic or gallbladder pain. Now, the issue when it comes to pain just in general is that a lot of people assume that it's related to your gallbladder. It's not the case. It's got to be very specific for that. And with that, we can maybe do an ultrasound, get some blood testing, and with the imaging test and the blood testing, this will give us a suspicion that you have stones in your gallbladder. And then once you've had pain from gallstones, the recommendation is to get your gallbladder removed because there's an excellent chance that pain will come back and come back and come back. Now, a caveat to this is that asymptomatic gallstones in the vast majority of people do not cause problems. So I need to be very clear. When I tell my patients, or what I tell my patients is that if you have gallstones in your gallbladder, this does not automatically mean that your gallbladder has to be removed. What we do need to do is make sure you have the right clinical indication. You have that pain that's specific for that. And also that we think that pain is related to your gallbladder. So if I have a patient come to see me who has lower abdominal pain, and I do imaging, and I see gallstones, I am not going to recommend getting your gallbladder removed because it's not going to make you feel better. And so kind of keep that in mind. A second reason to get your gallbladder removed is that you may not see stones, but you may see sludge. Sludge are small little granules kind of within the gallbladder area that are very hard to see sometimes with imaging tests. But sludge over time can form into stones. And so if we have a suspicion that sludge is the cause for your issues, we actually don't see a stone, this may be someone you may want to consider getting your gallbladder removed. Now, once again, this can be hard to determine because it's hard for us to see sludge. I don't see sludge all the time, and a lot of people don't. There may be more specific tests that we can do to hopefully figure out that's the case, but that may be the reason why. A third possible reason, though it's kind of low in the differential, is if it's not working correctly. So people use this thing called the HIDA scan, or an ejection fraction of your gallbladder. Now, this is not a very good test, and it's not very accurate. And what I tell my patients is that sometimes, even if your gallbladder is not working correctly, or the ejection fraction is low, it doesn't mean that getting your gallbladder removed is going to make you feel better, nor does it mean that your gallbladder is actually not working correctly. And so this can be a little bit of a misnomer, but a lot of people use this as a way to measure their gallbladder. I'm not quite sure exactly why. The HIDA scan is a very accurate test for what's called cholecystitis, or inflammation of your colon. But in terms of gallbladder issues, it's not a great test. But the true indications are if we see gallstones associated with pain, fever, high white count, elevated liver tests, we think that's the cause for that. And that's the time when you absolutely want to get your gallbladder removed. Now, there are a couple of issues that occur for a lot of my patients who get their gallbladder removed. So one issue is that it can be normal. You feel good, and that's fine. That's the route we want to go down, because we want to make sure we can do something for you that actually gets you benefit, but it's also actually going to make you feel better as well. So the best thing is that your gallbladder is removed, you feel better. But there are a couple of issues I'm going to describe in more detail, but what can occur after your gallbladder is removed. So issue number one is pain. You still have the pain that you came in to begin with. Now, there are a couple of different reasons why you can have the pain, especially after your gallbladder is removed, or even years later. One is that the gallbladder was not the cause of the pain. And this is why it's very important for us as doctors to really specify that we're doing a test for you for the right reasons. Because nobody, no surgeon, no GI doctor wants to do a surgery or a procedure and you don't get the benefit that we want to get. So maybe the indication is wrong. Number two, you can still form sludge and stones even after your gallbladder has been removed. Yes, you can. This is a very common misconception that once you get your gallbladder removed, you don't need to form any stones. You can't. That is not correct. And so years later, I have a number of patients came to see me. Hey, Dr. Islam, I got that same pain on that right side like I had before, but my gallbladder's taken out. What is going on? And we may do imaging tests and we can see, yes, you have a stone that was formed in the ducts. That's why you're having the pain. We may need to fish it out. Or it could be a spasm in what's called the sphincter of Oddi. So that sphincter is a small little sphincter or a valve that allows bowel to secrete out. And sometimes that can be spasm or contracted as well. And that may be the reason why you're having the pain. So when I have somebody come to see me who's had their gallbladder removed and they're having pain on that side, I try to figure out what's going on. So number one, is there pain, gallbladder type pain? Is it right-sided pain that can sometimes radiate to the back, that sometimes gets worse or better once you eat or once you're associated with food? Is that the reason for that? That's question number one. Question number two I ask is, do we need to do imaging to find out what's going on? So sometimes we'll do what's called an MRCP. This is an MRI of the pancreas, the bile ducts, to see if we can find small little stones, small little sludge, and see what's going on. Number three, I'll get some blood testing. Do I see your liver numbers going up? Because if I see the liver numbers going up, this would give me a better clinical suspicion that there may be a small stone or a small sludge to cause your pain to occur. So let's say we see something like that. What can we do? So if we see a stone, we can fish out that stone and do what's called an ERCP. And this is where we go into the ducts and use one of our devices. We have a lot of cool devices in GI. We can actually fish out that stone and remove that. Or if we think there's sludge, we can do the same thing. We can get something out to root that area and to remove that sludge. But if we don't see anything and we don't think that's the case, sometimes we'll use anti-spasm medications to help relax that sphincter. The most common one being Elavil or amitriptyline, which in very low doses has been shown to help out with sphincter problems and pain as well. But that's kind of the approach that I take as a Mayo Clinic trained GI doctor when it comes to pain post-cholecystectomy. Now, the other reason why you can have issues after your gallbladder is diarrhea. It is common to have diarrhea after your gallbladder has removed. What is going on? So remember, like I said before, your gallbladder is an organ to store bile. If you don't store that bile is going to just go off into the colon and cause irritation and diarrhea. That's called bile acid malabsorption, or diarrhea, BAM. This is a very common problem because the bile salts that are being secreted cannot be absorbed effectively in the colon, and that in turn will cause diarrhea to occur. So a lot of my patients, when they complain of diarrhea, it's like yellow stools, it's green stools. Nothing will get them through it. Nothing will help them. They'll have so much diarrhea that's there. So what is the approach that I do when I have somebody come to see me with bile acid diarrhea? Well, we'll do some testing to confirm that. I may get some blood testing, check for celiac disease, but I also may do a colonoscopy and take biopsy of the colon to see if there's any other condition that could explain the diarrhea. So keep in mind, just because your gallbladder is removed and you're having diarrhea, that may not be the only cause for the diarrhea. Crohn's disease, ulcerative colitis, celiac disease, small intestinal bacterial overgrowth, colon cancer can also present as new onset diarrhea. Now, if we do this, your colonoscopy is negative and the biopsies are normal, then I would suspect it's called bile acid diarrhea. So we can give you medications to help out with that. There are a lot of bile acid binders that are out there. There's 3 of them mainly that we use, things like Welchol, cholestyramine. These medications actually work, and what they do is they help bind up the bile so you're not having as much bile in the colon to cause as much diarrhea. Now, these medications have their own side effects because they absorb so well in the bile. They can absorb also some of the other medications that you're on. So typically what we recommend is to take this medication either 2 hours before or 2 hours after maybe your medications that you're on normally. But it's called bile acid diarrhea. Number 3, reflux and just upper GI issues. So you may be having worsening heartburn, worsening bloating, just worsening upper GI issues. What is going on? So it's the same concept that we talked about when it comes to bile acid diarrhea. That bile, instead of going into your colon, is refluxing up into the stomach. So you have a lot of bile in the stomach to cause irritation and gastritis to occur. And this may be a reason why you're not responding to the traditional acid medications that may usually treat acid reflux, because it's not an acid problem. It is a bile acid problem. And the treatment for that is very different. So what is my approach for that? So obviously I'll make sure you're taking your acid medication correctly to make sure it's not acid reflux. So 30 minutes before your first meal, or maybe twice a day before dinner, and seeing how you do. But I actually may also consider taking a look with a scope to see what's going on as well. Because with that scope, I can see exactly what's going on inside that stomach. I can see if there's irritation, inflammation. I can see if there's bile actually pooling in that area. But I can also rule out other things like hernias, ulcers, H. pylori, things like that. Now, let's say that we think that it is bile acid diarrhea. What can we do? Well, once again, the same idea. We can use bile acid sequestrants, Carafate, Welchol, cholestyramine. Carafate's medication to help soothe the stomach, so it's not really a bile acid sequester, but the other ones are, because we want to reduce the amount of bile that's inside your stomach to make it easier for you to digest, and so you're not having as much issues as well. The other issue is that you can have fat, just foul-smelling stools. So going along the same lines of diarrhea, remember, bile is used to absorb fat. And so if you don't have the capability to secrete out bile in a consistent manner, you're going to have a lot of fat malabsorption, which is going to manifest as just oily, foul-smelling stools that nobody wants, which also manifests as diarrhea. Next is that you could have another condition which can be related to getting your gallbladder removed called small intestinal bacterial overgrowth, or SIBO. Now, I talk about this a lot in my other podcasts, but SIBO is a abnormal growth of bad bacteria in the small intestine that can cause pain, bloating, nausea, feeling like you're pregnant, diarrhea, and constipation as well. And this is actually a separate condition than getting your gallbladder removed, but it's within the same spectrum because it can be a risk factor for that. Now, the way we test this is that we can do what's called a breath test, where actually can have you breathe into a machine. We see how much you breathe out the bad bacteria, and if that's positive, meaning that you have bad bacteria, we can give you medications to get this taken care of you and to resolve the diarrhea as well. And so this is a very common problem that a lot of patients have whenever they're having their gallbladder removed as well. So these are things that I see as a GI doctor post gallbladder removal. So what can you do in general? Let me give you some recommendations on some lifestyle changes for anyone who's had their gallbladder removed. And basically, these are great lifestyle changes I recommend for anybody at all. So number one, what I found is that eating smaller frequent meals all throughout the day tends to be a lot better for a lot of my patients as well. So having small frequent meals, 5 to 7 meals throughout the day, small amount, is going to make it a lot easier for your gut and a lot easier for you to digest. Number two, don't go crazy just when you get your gallbladder removed in terms of eating food. Gradually reintroduce those foods. Go slow and go low because it'll make it easier for your body to digest. Number three, I would recommend for you to follow a low-fat diet. Fat, we know, can stimulate the bile and stimulate the extraction of bile and the release of bile. So you want to have a low-fat diet to see if we can hopefully not have as much irritation and inflammation going on inside that stomach. Obviously, hydrate yourself. If you're having diarrhea or pain, hydration is going to be critical to make sure you can maintain the status of your gut so we can get you feeling better as well. Certainly, exercise is mandatory. Everyone has to exercise. There's no reason why you shouldn't. You want to try to, my recommendation is to aim for 30 minutes every single day. Make it a commitment, make it a habit. It's one of the very few things in life that can literally cure you, and it's free and can help out as well. Obviously, stress can play a role in terms of making gut issues worse, so make sure you can manage your stress as well. And then lastly, consider some other options in terms of lifestyle changes like sleeping better and things like that to help out. And then probably the most important things I'm going to recommend is that adding more fiber will help out. Fiber is a natural way to bind up that bile, both in your colon and in your stomach as well. So use soluble fiber as a sponge to grab that bile, take it from you, take it from your body, and get you feeling better as well. So let's go into specific foods that I recommend to maybe help out when it comes to gut issues, especially post-gallbladder issues. So number one, like we mentioned before, low-fat foods. So these includes very lean protein. So I recommend chicken, fish. These work really, really good. Maybe low-fat dairy or maybe even no-fat dairies. Things like yogurt, milk. Check the fat content on that to see if it makes it better for you or not. Egg whites, whole grains. Things like brown rice and quinoa. These things work to hopefully give you the fiber that you need, not add any more stress to your gut, and to minimize the fat that's there. Number two, I mentioned this before, but soluble fiber is fantastic for your upper GI health and your lower GI health as well to help out when it comes to some of the GI issues after your gallbladder has been removed. So incorporate things like oats, apples, bananas, carrots, sweet potatoes, and barley. These are fantastic sources of fiber and whole grains that can maybe allow you to digest the foods after your gallbladder has been removed. I mentioned before, small frequent meals, 5 to 7 meals per day is going to be helpful. And then also, too, just make sure you can add in as much plants as you can as well, because plants will help out when it comes to rechanging your gut microbiome and making it better as well. And certainly there are certain anti-inflammatory foods I do recommend. So things like fatty fish, like salmon and sardines, leafy greens like spinach and kale, berries, which are fantastic for you, red berries, blackberries, strawberries, these work great. And then turmeric, I actually recommend adding extra turmeric to see if it'll help out when it comes to your gut issues to get you feeling better as well. Now, if you've had your gallbladder removed, there are a couple of foods that I recommend to avoid so you don't make things worse. These include high-fat foods, so things that are fried foods, fatty foods, full dairy foods, that whole jug of ice cream and dairy. These are foods that will stimulate your liver to produce more bile, which will be just going rampant everywhere inside your gut to cause a lot of gut issues as well. Number two are spicy food. This may irritate the digestive tract, especially if you have upper GI issues like bloating, distension, and acid reflux as well. You may want to minimize caffeinated foods and carbonated foods because these will make your symptoms a lot worse. Caffeine acts as a stimulant for your gut to make it more likely for things to pass through and cause diarrhea issues to occur. And certainly carbonated drinks will make bloating worse as well. And I certainly recommend to minimize or get rid of refined sugars or processed foods. These will absolutely trigger your symptoms, make them a lot worse, and making you feel worse as well. But these are my tips that I've seen over 10 years of treating patients who've had their gallbladder removed. They work. It can help out with your gut issues, get you feeling better. And I think that if you try to implement these in your daily habit, it'll help out and hopefully get you feeling better as well. All right, so as we go into the live stream, let's see if we can have any questions here. All right, perfect. All right, good question. So question number 1 is, can you get colic without a gallbladder? Yes, you can. So you can get that biliary colic without your gallbladder. And the question is why? Well, if your gallbladder has been removed, it could be a small stone that's there, it could be sludge that's there, or it could be a spasm of that sphincter. And sometimes that may be the reason why you have that colic that's there as well. The next question, what causes sludge? Same thing that causes stones. That bile that goes into the area of the bile ducts in the gallbladder, it acts like soot that can kind of get clumped together and eventually cause sludge and irritation to occur as well. All right, guys, perfect. All right, well, that was my deep dive on what I recommend to get your gallbladder removed. If you like what you see, if you like what you hear, consider subscribing to my channel. Come see us locally if you live here in Lubbock, or if you even don't live here locally, come see us. We offer telemedicine health to get you taken care of. I look forward to seeing you guys on next week's podcast. Thanks for watching, and hope you guys have a great and happy day.